Mm-hmm.
Audio. Magandang hapon, Pilipinas. Magandang hapon po, Luzon, Visayas at Mindanao. Magandang hapon sa ating mga kababayan na nasa iba't ibang sulok ng Pilipinas. Gayon din po naman sa ating mga kababayan na nasa iba't ibang bahagi ng mundo. Good afternoon to our friends in media who are with us this afternoon. Thank you for joining us sa ating po mga sumusubaybay. Of course, doon sa mga samahan natin sa Department of Labor and Employment na nasa iba't ibang post across the globe and yung mga nasa regional offices. Tayo po ay walang sawang naglilingkod sa ating mga kababayang manggagawa. Today is Monday, Ang huling araw ng Pebrero, ang bisperas ng Alert Level 1. Tomorrow ay parang Independence Day. Pero ngayon pa lang, madami na nagdiriwang. Daig pa ang Independence Day. Liberation, sabi nga nila. Kamusta po kayo mga kababayan? Kahit ng liberation na tomorrow, sana patuloy po kayo nag-iingat at hangad namin mula dito sa Department of Labor and Employment sa pamumuno ng aming butihing kalihim, Secretary Bebot Bello, na nasa mabuti po kayong kalagayang lahat, free from COVID. Yan, sana wala nang dumating na ibang variant, sana tapos na nga ang kwento ng Omicron o Omicron. Sana wala nang Omega, ano ba yun? O whatever. Dahil nga po, bisperas. At teka mga kamusta natin mga kasama natin sa media? Andyan, kasama natin si Zen. Kasama natin si Zen Hernandez. ABS, si Sammy Denilla ng Business Mirror, si Donna Pasibugan ng Inquirer, si Gerard Naval ng Malaya, si Mayen Alquitran ng Philippine Stars, Tristan Nodalo ng CNN Philippines, si Neil Morales ng Reuters, at si Divine Reyes ng DZBB, si Tess ng Taxi. Konting update lang muna tayo mga kasama, kahit na wala akong audio dito. Wala akong monitor. Wala tayong monitor. Ayan, hinahanap pa ni Paul ang monitor, kaya para akong bingi dito. Paganda ang kaso ng COVID po dito sa ating bayan at sa ibang dako ng mundo. Ganyan din ang nagiging kalagayan sa Taiwan. 797 ang bagong kaso ng COVID the last 24 hours. Samantalang sa Hong Kong, oh my July, 35,871 ang pinakahuling kaso ng COVID na naitala in the last 24 hours. Ito po ay, ang binabanggit po namin dito ay yung batay po sa report ng ating mga Philippine Overseas Labor Offices na isinumite kay Secretary Bebot. Po. Sa Kuwait, 607 po ang pinakahuling kaso ng COVID na naitala sa kanilang lugar. Samantalang sa Kingdom of Saudi Arabia, 632. At sa Israel, 6,254. 6,254. Yun po yung mga pinakahuling datos. Batay po sa ulat ng ating mga Philippine Overseas Labor Offices sa iba't ibang dako ng mundo. At sa Australia, nagmula sa 36,000, naging 18,000 na lang po, 18,667. At sa Pilipinas, a little over 1,000. Tama ba? Kahapon po yun. And ang pinakahuling bilang naman po, mga nakauwi natin mga kababayan na naihatid na sa kanilang mga lalawigan ng ating Overseas Workers Welfare Administration, umabot na po ng 947,856. Yan po ang kabuang bilang ng ating mga kababayan OFWs mula sa iba't ibang bahagi ng mundo na nakauwi na, either they were distressed or they're vacationing, at na naihatid na sa kanilang mga lalawigan sa pamamagitan po ng mga serbisyo ng Overseas Workers Welfare Administration. Kasama rin natin si Luisa. Ayan, magandang hapon, Luisa Rispe ng PTB4. Si Luisa mag-aasawa na yata. Okay. At dahil nga po, bispiras ngayon ng tama ba? Bispiras ano? On the eve of the alert level 1. Ang bispiras ng Independence Day, ng kalayaan. Ang mga kakasama po natin sa ating kwentuhan ngayong hapon, ang pangunahing representative po ng Department of Labor. Siya po yung umupo sa technical working group ng ating IATF, ang ating pong Assistant Secretary and concurrent Director po ng Bureau of Working Condition, si Dr. Teresita Cucueco. Magandang hapon po, ASEC Tess Cucueco. Kamusta po kayo? Welcome to V-Café.
Magandang hapon din po, Director Rolly, at sa lahat ng mga kasamahan po natin sa media. Good afternoon po sa inyong lahat.
Ma'am, long time no see. Mukhang blooming ka, ma'am.
Okay. Thank you. Bisperas kasi. Bisperas. Bisperas na alert level 1.
Sa ngiti mo pa lamang ASEC Tess, mababanaag natin ang napakagandang hinaharap ng ating mga kababayan manggagawa pagpasok ng alert level 1 bukas. Kamusta po, ma'am? Ano po ba ang pwedeng asahan ng ating mga kababayan sa pagtatamasa ng malaking bahagi ng ating bansa under alert level 1, the very first time na ang ating bansa ay makakatim ng alert level 1? Go ahead po, ASEC.
Director Rolly, hindi buong bansa ang nasa alert level 1. Yan lang gusto ko pong kasi meron pa hong ibang parte ng Pilipinas na nasa alert level 2. Although marami po sa mga lugar natin talaga nationwide ay nasa alert level 1 na. Hindi ko lang alam kung natutuwa yung mga manggagawa, pero ganito, nandito pa rin po ang COVID. Yan ang dapat natin isipin at nasa ating mindset. At pero sa kadahilanan na bumababa na talaga ang kaso natin at tayo ay protektado dahil sa bakuna at yung ating healthcare system natin ay talagang maluwag na dahil hindi na napupuno ng mga kaso ng COVID. Nandito na ho tayo ngayon sa alert level 1 na pwede na hong bumalik to 100% ang mga manggagawa sa workplace as long as they are fully vaccinated. If not, nandun pa rin ho ang mga patakaran na yung unvaccinated ay may testing. So nandun pa rin ho, hindi ho natin tinanggal yan. Nandun ang provisions na nakasaad pa sa dating IATF resolution. Tapos sa public transport, full 100% seating capacity, wala nang barriers. Sa pagpasok ho ng lugar ng paggawa, hindi na ho kailangan may temperature check, hindi na kailangan may health declaration. Pero dahil nandito pa ho ang COVID, ang self-responsibility ho natin na kung tayo ay may nararamdaman, ay hindi na ho tayo papasok at pagkonsulta na lang po telemedicine. So, this gives now the opportunity for the economy to really move up and for workers to start again going back and be as productive or they were also productive naman sa mga work from home, but kumbaga we are now really looking at boosting the economy and the productivity sa alert level 1 po.
So, Asek, the long and short nung sinabi mo, alert level 1 nga, umpisa tomorrow, subalit. Requirement pa rin ang bakuna para sa mga magtatrabaho. Kailangan fully vaccinated. At kung hindi, they have to be, ganun ba yan? They still have to be tested.
Yes,
dumaan sa RT-PCR.
Yeah.
Ibig sabihin, kung meron dapat magdiwang dito, ay yung mga bakunado na di ba, na easily can come and go, can report every day doon sa kanilang workplaces. Pero hindi ba yan alisin as a test yung requirement ng total bumababa naman ang kaso na ng COVID. So why are we so strict still in implementing the requirement for vaccination?
Can I also, before I go to answering that, I still have to also again remind everyone na because COVID is still here, although we're in alert level 1, what is required for all indoor and outdoor is the use of mask. Kaya, kasi sinabi ko na yung 100%, pero dapat nakamask po tayo. Kasi yan din ang protection. I mentioned vaccination, but I forgot. I skipped my muna, that the mask should be worn because that is a primary protection tool. And second, that there should be good ventilation in all office spaces. If it's outdoor, that's really the best. But if it's indoor, then there are good ventilation measures should also be provided. Then that's why we can now, and then if you're fully vaccinated, then they can, there's no kumbaga, the risk of being infected is really low. Now you were asking po, hindi ba ho natin ibababa? Alam niyo ho, isang level of protection pa rin ho ang vaccine. And even if we say, bakit yung mga nababakunahan, nagkakasakit din, lalo ho natin babantayan yung mga hindi nabakunahan dahil sila nga ho ay pwedeng malagay sa yung severe critical na kaya nga ho binabantay natin sa test, kung meron na hong makitang magpositibo, edi ma-manage ka agad po ang sakit. If kung wala na pong COVID, baka doon na rin po natin titingnan. But again, we look at the how the disease will evolve. Kasi tingnan nyo ho, even our mechanisms and our strategies have also been evolving with response to our protection and how we're also reducing our risk to be infected with COVID.
So ang ibig sabihin po, ASEC, alert level 1 nga, ang epekto lamang niyan immediately ay to expand the capacity or to allow the full capacity of our workplaces insofar as the department is concerned, no? Lalo na sa private sector. Subalit, the restrictions are still there, di ba? The restrictions are still there. Ibig sabihin, kailangan pa rin sundin yung mga protocol. The protocols remain, including ay ang tinatawag na ventilation in workplaces, ASEC. Halimbawa, paano mo ngayon matitiyak under alert level 1 na ASEC na itong mga kumpanya nagdagsaan na kanilang mga trabahante, ay paano ngayon natin titiyakin na they are still observing the protocol?
Dapat may safety officer kasi nakasulat din yon, the need for the safety officer in establishments to monitor that that they're complying with the minimum public health standards, the protocols. Although yung physical distancing and because we're already allowing 100% on-site, yun ang we still have to assure we have that safety officer will have to ensure that even if it's 100%, because they're wearing masks, they're fully vaccinated, and there's good ventilation, mabababa din yung risk. Kung may nagmo-monitor naman din po.
We will rely heavily on the safety officers of companies, enterprises, mga ganon. Pero how sure are we na ASEC na magre-report ng tama itong mga safety officers na to? Do we have sufficient manpower to check on these safety officers that they are reporting the right data, the right information to us?
Number one po, we of course there's a responsibility, individual responsibility na lang din po natin, because we know what can happen. Then the safety officers and that the DOLE's mandate for inspection is also there, would help in ensuring compliance. However, because we cannot really enforce or inspect the whole 100%, what we're saying is the risk naman at this point where cases are going down, where there is additional protection with the use of vaccine, the use of the mask, good ventilation, and the vaccination, the risk is also going down as well. So we hope that we now have that responsibility to watch out for ourselves and our co-workers. So yeah, I know this is the start of the alert level 1. We will also have to learn from it, but we will, the measures po and the other issuances may follow after we see how we are going to move forward with all of these measures in the alert level 1. Kung ma-maintain mo natin na yung mga kaso ay talagang tuloy-tuloy na pagbaba, maayos naman po, pero kung may magiging problema, tataas na yung kaso, titingnan mo ulit natin, baka mag-recalibrate lang ho tayo ng mga strategies again in addressing or looking at how we should respond to the alert levels. And lalo na alert level 1 po.
Ma'am, balikan ko lang po yung compliance sa protocol. Would this require the department to double up our efforts to do inspection of enterprises, of companies, ma'am?
Yes, alam mo, that has always been naman of the secretary to ensure that all the general labor standards, safety and health standards, including the COVID protocols, are also are inspected. So our targets are also have increased, and we have also noted that these are also certain priorities that still have to be, that continue to be done by the DOLE and its regional offices.
Ma'am, ang pagkaunawa ko po, para makatulong sa ating mga kumpanya, no, na na sumunod or institutionalize o ilagay yung kanilang safety measures diyan sa mga pagawaan sa mga workplaces. Ay in-encourage natin ang karamihan sa ating mga kumpanya na mag-acquire ng safety seal certification. Kamusta na po ba, ma'am, so far? And factor in ba itong dami ng mga kumpanya na nabigyan ng safety seal upang nakakontribute ba ito para mag-declare na ng alert level 1?
Ang safety seal ho, kasi although even in alert level, hindi po mandatory kasi kung dadagdagan po natin yan, alam natin may mga ibang kumpanya, mga ibang establishments na mahihirapan mag-comply, but that does not mean to say they should not be looking at other measures kasi medyo may kahigpitan din po ang safety seal. Kaya nga, yung safety seal, pag nakita niyo po yon, ay nagbibigay ng guarantee na nag-comply ho sila sa minimum public health standards, fully vaccinated po ang mga tao doon at yung mga papasok sa mga lugar na yon ay ang tatanggapin nila ay fully vaccinated din. At ano yun, these are compliances that will make us, for example, the general public feel confident in entering the workplaces. But that does not mean to say it is mandatory yet kasi sa dami po ng kumpanya sa buong Pilipinas, which will really be more or less a million, mahihirapan din ho kung ang pag-i-inspect hindi lang ng DOLE kasi ang safety seal full of government po to, nandun po yung Department of Tourism sa hotels and restaurants inside hotels, and lalo na ang DILG. Marami na inspection. I think we have more than 50,000 nationwide establishments with safety seal. And the LGUs, of course, which has the most number of establishments to be inspected, have also been doing its part. But then it will really be very difficult for all to make it a requirement na bago mag-alert level 1A nag-comply, nakita na ho namin that there might be some difficulties if this is going to be used as an indicator. Kaya ang nakita ho natin for addressing that, we're looking at the escalation, yung cases po at yung health systems capacity na lang po.
Alright. Kasi naisip ko lang, ma'am, iba, may mga kumpanya din kasi na parang, alam mo yun, parang binabaliwala yung safety seal na tingin kasi natin malaking bagay yon para maano yung confidence ng hindi lamang of course ng kanilang mga kliyente, di ba? Pati kanilang mga manggagawa. At least malakas ang loob o kumpiyansa yung kanilang workforce na magtrabaho dahil yung kanilang workplace ay may certification or certified safety.
That certificate po is shows the compliance to all the standards, if it's the DOLE issued, to all our standards in the DOLE, and of course the minimum public health standards po.
Among the sectors na binibigyan ng safety seal ng DOLE, would you know, would you share with us, with our friends, kung alin dito yung pinakamarami so far? Well, if you have on your, kung wala naman, ma'am, we can share later. No problem.
Share na lang, pero kasi ito yung mga that's why I will need, but we have the data. Manufacturing, construction, logistics, BPOs, utilities, these are the sectors where the DOLE should inspect for the safety seal. So marami na rin pong manufacturing, construction that have been issued and inspected by the DOLE. Then yung BPOs meron na rin po, but I will give you na lang po. I will share with you later the data of our safety seal and the breakdown of this the type of establishments under the DOLE jurisdiction po?
As initially, sa pag-de-escalate, no, the Department of Trade and Industry has an initial estimate na ang parang ibabalik sa workplaces ay an additional 500 to 800. Is that a fair estimate, or can we say it could be more?
Kasi if I would just, although I don't know what the formula or the indicators that the DTI used when they said 500,000, but ganito rin na lang po ang titingnan natin, marami hong mga types of work, lalo na manufacturing, that were not able really to do the full 100% because they because of the restrictions to, of course, physical distancing, the number of workers. But now that they can really do full blast production and operations, we might really have more numbers as we talk of yung mga key implement generators natin, construction, manufacturing, the BPOs, and they're now, the connectivity issue, because now they can go and report on site and allowed to do that already. We might really see a higher, hopefully, a higher number of workers, again, being part of the workforce as we are going into alert level 1.
So, tama po ba yung ating initial assessment that tomorrow will be Independence Day?
Sa mga iba, pero meron pa rin natatakot kasi sabi nga nila nandiyan pa ang COVID. Pero ganito na lang po, we do have to start, it's not naman na changing our, we have to, kasi risk aversion is our most difficult, is a challenge. What we would like everyone to start looking at is the reduction of risk, because we are protected. We have gone through Omicron, where we had that 39,000, and we had mild symptoms, and people really, after they went back to work, our cases are going down. We have boosted a big number of our population, even children are now being vaccinated. We hope that risk aversion will shift to understanding that as long as I am protecting myself through the use of the masks, also continuing the disinfection, going to places where there is good ventilation indoors, especially better outdoors, then I can now start really kumbaga, going back, and the usual activities that we were so scared of, maumpisahan na rin ulit.
Can we give way to some questions from our friends in media? I'm sure there are a lot of things they want to clarify with you, especially now that we are on the eve, or tomorrow will be actually the first day of this alert level under the new normal. Tama ba yan, ma'am? When we set in to alert level 1, this is now what we call the new normal. Tama po ba?
I think we have to, kasi ang alert level, this is where we still have to define, and I'm also going to wait for that, but we're on alert level 1, may COVID. Ang new normal ba is defined as no COVID or really very low levels. So let's just use it na rin po as just an alert level 1 is the new, kasi we have not really defined what the new normal condition would be po.
Okay.
So we've been using it very loosely in the past, di ba? At we go down to, we were thinking baka alert level 1 will be the new normal, but let us also see that there might be a situation that would talk of a new normal po.
At hindi pa po yan napag-uusapan, na-define sa level ng IATF, ma'am.
Napag-uusapan na po, pero hindi pa po talaga nakaklaro, or unless baka ang DOH po maglabas na, magiging clear na po tayo doon.
Okay. All right. So ma'am, unahin po natin siya kasi kasama natin si Zed Hernandez ng ABS. Baka I'm sure she's got a couple of questions for you. Magandang hapon, Zen. Hi, Zen. Yeah. Wala si Zen. Oh, all right. No. Okay. We go to Sam Medinilla, ASEC. Sam Medinilla ng Business Mirror. Magandang hapon, Sam.
Good afternoon, Sir Rolly. Good afternoon, Ma'am Cucueco. Ma'am, magtatanong lang po kami kung meron po kayang record ang DWC ng compliance rate ng establishment pagdating sa mga sa safety officers.
Meron naman po. Yes, we do have that. And we can share that with you. I just don't have it now, but we do have. And marami naman ho talaga nagko-comply. Although there are also those that have not complied, but we do really see a big number of our establishments complying with the safety officers that are required, because it's not just for COVID. Remember, even for safety and health, nandun na dapat ang safety officer po.
Tapos second question, Ma'am, may data po kaya sila kung ilan po yung safety officers na nakaregister sa DOLE?
Hindi mo namin, if you're talking of accreditation, may accredited po, pero we're not asking that they be accredited, because as long as they have that necessary training, kasi pero may requirement pang safety officer, hindi lang designated, may required training po yan, and this should be, ang responsibility po niyan ay yung mga kumpanya. And when we do the inspection, we also look for those requirements for the safety officer po.
Mm-hmm. Tapos ma'am, yung meron po yung pag-violate po ba doon sa new guidelines ng IATF for alert level 1? Halimbawa yung sa mga ventilation, wearing of face mask, tsaka yung sa dapat vaccination requirement for on-site employment. Dapat pag nag-violate po ba doon, considered as occupational safety and health violation po ba yun?
Ganito po yan, we would like always to approach this very with all the necessary support, kasi developmental pa rin naman po tayo. We would like to help companies and assist them to comply, because kung may willful violation pa rin na mangyayari, then it will really go into violations for penalties under safety. But we don't like to go into that, because we would like to see kung ano yung mga conditions kaya hindi sila makakomply para makatulong naman ang DOLE.
Last na lang po, ma'am. Yung sa last 2 years po na since nag-start yung pandemic, meron na po bang na-penalize yung DOLE na mga establishment dahil sa violation ng IATF guidelines for anti-COVID prevention? Tsaka if yes po, mga ilan po kaya yung mga na-penalize ng DOLE na companies?
Like katulad ng willful violation po ito eh. And from our end, I will check, but kasi it's with the regional offices naman po. And all the regional offices before kasi may period to may period to comply, which will run all the way to 90 days. So let us see, because most likely once the companies know they have a violation, nagko-comply naman din sila kasi mataas naman din po ang compliance after inspection.
Okay. Maraming salamat po, ma'am. Maraming salamat, Sir Rudy. Thank you po.
Thank you, Sam. ASEC, sunod po natin may tanong din si Donna. Si Donna Pasibugan ng Inquirer. Magandang hapon, Donna.
Yes, good afternoon po. ASEC, hanggang kailan po itong patakaran na kailangan vaccinated ang on-site workers?
Wala ho kaming time frame doon kasi ito yung nabas po ng IATF last year. Ito yung IATF Resolution 148B. So until pero alam niyo po, this has also been challenged in the courts. So we are also being very careful about discussing this, and unless the courts decide or unless national government will have an issuance, then it will continue to be implemented po.
At ma'am, ano naman po kaya ang sentiment po both ng employer side at saka po ng employees side dito po sa yung ganun pong limitation or restriction pa rin? If what we're after is, kaya nga po tayo raw na alert level 1 is to get 100% capacity. So paano po siya, paano siya mare-reconcile? At ano po ang feedback po na natatanggap ninyo?
Reconcile saan, ma'am? Sa vaccination or reconcile to the wants of the employers and employees? Yun po ba, ma'am? Para
Yun pong yung feedback po nila dun sa ganung pong may restriction pa rin na kailangan bakunado lang ang pwedeng pumasok, or otherwise they have to pay for their regular test every 2 weeks. At how do we reconcile this that continued policy with the government's aim to get the economy 100% back?
I think we know that the best vaccine hesitancy has gone down to 10%. Of course, that is not because of the IATF resolution, but what helped was moving employers and HR to addressing why there was a hesitancy in the first place, and the fears perhaps, and giving more encouragement and incentives for these workers so that they are vaccinated. So now we're seeing yung vaccination hesitancy to be very low, and we continue to address their fears and why they do not want to be vaccinated. So kung hindi pa rin talaga tayo nagbabago ng polisiya, karamihan naman po ay talagang bakunado na. We know that there are many of especially in manufacturing sectors, that have almost 95% of their workers, but then there will still be a percentage, and they're also continuing to work with these workers to see how the approaches to get them vaccinated. But we hope that in the end, they also understand the level of protection from vaccination, so that they can really be going back to work. Kasi yun nga ho, it's still a requirement that if you're required, because okay naman na sila magtrabaho on site, hindi namin but there is the need that they should be having themselves tested.
Salamat po. Isa na lang po, tungkol naman po sa testing. Ma'am, ano naman po ang DOLE or government policy or recommendation on the continued use of antigen as screening for even asymptomatic employees? Alam naman po natin na meron pa rin pong mga, kahit na po sinasabi ilang beses na ng DOH, that the rapid antigen test is not accurate when used as screening asymptomatic, no? Or kaya wala naman pong known exposure, but it's still being used. And kaya nga po marami pong mga workers nga po na when they test positive sa rapid test, bigla silang kailangan mag-isolate na, and then they have to pay for the expensive PCR test, only to find na usually negative sila sa PCR test. But syempre, ano na sila na, kumbaga nakapag-absent na sila, or meron lang kailangan gawin sa opisina. So ano po ang policy nga po dito ng DOLE po?
Sumusunod lang ang DOLE sa DOH. We have always discouraged companies to do asymptomatic testing, because it really, especially for using antigen, for RT-PCR, kung close contact lang naman and you start to have, but then to use the antigen test where we know that, and you already said it, wala naman talagang, there's nothing conclusive after this. We are discouraging. And what we also tell companies, instead of wasting resources on this, they might want to put that resource into possibly adding more to, the productivity of the employees, or to add on to some companies, or to incentivize further other activities in their workplaces. Na matagal na ho namin sinasabi din yan, pero if they still do, please report na lang to the DOLE, to our regional officers, so that we can discuss this with them. It is, even in the alert na it has been very, in the guidelines, it is very clear that it is not required.
Salamat po. Thank you po.
Thank you, Donna. Asik, iklaro ko lang yung sinabi mo, no? Tama ba yung narinig ko na 95% na ng mga manggagawa ay bakunado? Did I hear you right?
I'm not, ganito po yun. There are manufacturing establishments that are saying, karamihan na talaga sa kanila. And in fact, yung dating yung 90% lang nila na naging 95% na nabakunado, because they continue to work towards providing the necessary activities or necessary awareness, so that the workers understand the need and why the value of vaccination for themselves and their families. So tumataas na rin po ang mga bilang ng mga bakunado. I just gave that because that was one of the examples given by a big manufacturing firm na from a high level, it went up to 95, pero yung 5% was translated to almost like 100 workers pa rin, but they continue to provide the necessary awareness, address the fears, so that they can get more of their workers vaccinated.
Okay. Ma'am, pasensya ka na pero may mga pahabol pang tanong, no? Si Gerard Naval ng Malaya. Magandang hapon, Gerard.
Hi sir, good afternoon.
Hi.
Asek, good afternoon po. Ma'am, 2 questions lang po. Yung una po, yung kung may concern po ba tayo with the with the shift to alert level 1, may concern po ba tayo with regards dun sa transportation ng mga workers? Kasi yung medyo may kakulangan pa po yata sa availability ng transportation when they go to work.
Lahat naman ng public transport open na and full seating capacity na. So we hope that would address, and companies can still continue if they've been providing shuttle services. We continue to say they can do that, but for those, because it's not a requirement that they provide this. In matagal na pong tinanggal yon, because of course the expense to that as well, but then because all public transport are already allowed to operate and at full seating capacity, we hope that we'll also be able to respond to the number of workers who have now, who will now start to report to work.
Follow up lang po dun sa when you said yung sa shuttle services. In your opinion po, ano po ang benefit nun for the companies if they continue to provide shuttle services for their employees?
Dapat na po nalaga nilang ginagawa yun. We have talagang, that's okay. We of course encourage that. But in the beginning po of COVID, where there was no public transport and many companies had to either rent or nag-contract for services for this, these were really additional expenses. But as we were opening up already for public transport to provide the needed transportation, it is not anymore required. But if that, kasi there are some companies who have been providing this and they want to continue, that's okay naman din po.
Another question na lang po, ma'am, last na po. Yung pong sa guidelines po ng IATF, allowed pa rin po yung work from home, even yung under alert level 1. Will the DOH, the DOLE, encourage companies to make it available to their employees po?
Nakasulat, can I just read to you the as written on how we kasi for the private sector, I'm just trying to find the we are saying that the employers, upon their policy, may continue to provide. But that is now dependent on the policy of the employers. So if they have really work from home activities or work that can be done and they wanted to continue, then that is a policy and we respect that. But if they really need all on-site work not to happen, then of course, the guidance is already there as well.
Salamat po.
Thank you, Gerard. Follow up lang ASEC, no. Ibig sabihin dahil prerogative na ng employers whether or not to adopt that work from home alternative work arrangement, do we encourage them to still under the this transition period to the new normal?
Let's leave it to the employers po. I would not like to say, because you might say the DOLE, but we leave it to the employers. They have already they've had work from home activities already, and they know what works. If it works for them, and there's certain work that can really be done and continue to be done at a good and is very effective, then that they may want to continue that. Pero meron din kasi yung mga iba na sa operations, sa manufacturing, na kailangan talaga yung 100% on-site, edi doon na ho talaga magiging ang polisiya talaga ng employer.
Right. Well said po, ASEC. So, maraming salamat dahil wala na tayo mga kaibigan sa media na nais pang magtanong at tila sila ay bahagi ng pagdiriwang sa pagpasok ng Independence Day. Kaya baka meron tayong mensahe, ASEC, sa ating mga kababayan. Mensahe ng department. Ano ang pwede nating sabihin, ipaalala sa ating mga kababayan ngayon na papasok tayo sa bagong level ng protocol ng pandemic protocol. Go ahead please po, ASEC.
Gusto na ho natin parating sa loob at paisip sa inyo na nandito pa po ang COVID. Hindi ho nawawala. So nandun pa rin ho ang mga minimum public health standards na dapat natin sundan. Masks should always be worn indoors and outdoors. May mga exception na po yung outdoors kasi mga nag-exercise na wala namang ibang kasama, pwede nyo naman po talagang tanggalin yan. Pero once you go indoors and there are other people, then those are requirements and these are the minimum public health standards. Then of course, we should not talaga na sa natin na yung ating hugas, yung disinfection, and in entering, for example, looking at ventilation, yung mga ventilation po natin, kung magagawa sa labas, better. Kasi kung may mikrobyo ba doon, talagang maano na ng hangin. Pero kung gagawin po sa loob, siguraduhin natin maganda din po ang ventilasyon para ang sirkulasyon po ng hangin ay makakapaglabas ng kung anumang mikrobyo o anumang kontaminasyon ang nandun sa loob at hindi makapunta sa mga iba't ibang mga tao sa loob ng lugar. And of course, vaccination. Sana po nandun ho ang ating pagpapahalaga ng itong proteksyon na to ay para sa atin at para sa pamilya natin. And at the end of the day, we all work together po because we will continue to say no one is safe until everyone is safe. So, po,
maraming salamat po, Assistant Secretary Teresita Cucueco, Dr. Cucueco. Salamat po, doctors, very enlightening at sana laging isaisip ng ating mga kababayan yung lalo na yung mga binitiwa mong paalala sa kanila. Thank you again, ASEC Test. Ingat po kayo.
Thank you po. Bye-bye po.
And on that note, nais po pasalamatan ng ating mga sumubaybay ngayong hapon dito po sa ating kwentuhan sa V-Café DOLE. At yung po mga kasama natin sa media who joined us, thank you very much for joining us. Paalala po doon sa mga regional directors sa bumiyahe na po kayo simula bukas kasi malayo-layo ang pupuntahan nyo para kayo makaabot sa sa planning session na DOLE-wide sa Webes. So we'll see you on Thursday, mga kasama nating regional directors at mga heads of agencies and bureaus. We'll see you sa planning session po ng Samantalang habang hinihintay natin ang planning session na yan, tuloy-tuloy naman po ang serbisyo ng DOLE. And well, again, thank you to our ASEC test Cucueco. At I think we will not see each other on Wednesday, at we'll see you hopefully on Friday. Kaya until Friday, at bago ko tuloy magpaalam, nais kong ipaalala lang, lagi na sinabi ni ASEC test, nandiyan pa rin ang pag-iingat. Sabi nga ni Sec Bebot, magpabakuna. Magpabakuna na. Madami pong bakuna, at yung may mga bakuna na, magpa-booster na po. Okay? So, sa ngalan po ng Department of Labor and Employment at sa ngalan po ni Secretary Bebot Bello, maraming salamat po. Magandang hapon sa inyong lahat.